the ACES Optimist Show with your host, Dr. Craig Morris.
Hi, everybody. Dr. Craig Morris here, and welcome to ACES Optimists, dedicated to optimizing human potential in the clinic of life. We are sponsored we have 3 sponsors now, including one new one. First, we're sponsored by Advanced Clinical Educational Seminars. That's acesforme.com. In addition to the Prague School of Rehabilitation and Dynamic Neuromuscular Stabilization out of Charles University in Prague, Czechia. So that's rehabps.com. And our third and newest is Inside Edge with the great K, Mr. Kevin Weeks. This is, you can find it at iehockey.com. This is a brand new network, just launched last Monday, and he is the greatest announcer in hockey, in my view. And I don't think it's there's much competition, actually.
I will concur.
And there we go. And so now you have another hockey expert in Greg and lifetime fan in Dr. Greg Doerr. And so we're happy to have him also joining and the Inside Edge as a sponsor. Today, I am joined by a clinician, a doctor of chiropractic extraordinaire, somebody after my own heart. I'm a sports rehab specialist, and he is another one. And Dr. Doerr has a very impressive background. He graduated with a bachelor's degree at Rutgers, and then later on, then completed his chiropractic training at New York Chiropractic College, now known as Northeastern University of Health Sciences, and also has a CCSP, Certified Chiropractic Sports Physician, also training. And he has 2 practices. So he's in New Jersey. He's a New Jersey chiropractor, both in Cliffside Park, New Jersey, yep. And also in Hackensack, New Jersey, which I know of very well because I'm a Billy Joel fan. And he has been in practice for 28 years. And so he has lots and lots of experience. And he has, in addition to being a clinician extraordinaire, he's an educator extraordinaire in sports rehabilitation in our field. He's really after my own heart. We both had the opportunity and the honor to have a chance to teach on all 6 continents over these last years, and have a chance to help to teach clinicians and help not just our own patients, but have the opportunity then to help their patients also, which is a great honor to have these invitations. But something where you have to earn your way, and he has more than done that. And Greg, thank you for joining us.
That's my pleasure.
We are, in addition to that background, he is also co-founder of the FAKTR courses, FAKTR, which are very well known domestically and internationally, which I believe began somewhere around 2010. So we're talking about 15 years or so, along with the great Dr. Tom Hyde, who was more my contemporary. Tom's a little older than me, and Greg is chronologically a little younger than me, and visually significantly younger than me.
Yeah, I don't have teenage kids yet.
That's coming in. That is a factor. Yes, that's a graying and aging factor of life. That's true. So tell us a little bit about your background yourself that I haven't included, Greg, so our viewers get a chance to know you a little bit better.
Well, from a standpoint of practice, my practice real career and the CCSP and all my education, things like that, that was all wonderful. But in all honesty, I could tell you I probably learned more at my first sporting event over a weekend than I did in 4 years of chiropractic school. And that's not to diminish what I learned in chiropractic school. That's to tell you how much I learned in one weekend at a Taekwondo event. Those are things that I could not have prepared myself for. In fact, I was fortunate enough, you've already mentioned contemporaries, mentors, things along those lines. And I was fortunate enough to be invited by Len Erschauer, who I didn't know from Adam at that point. It was through a mutual connection. He just said, hey, if he's into sports, tell him to come down. I was 3 months out of school. I had basically graduated in December, and this was in March. I'm all of a sudden attending. I had my license for probably, 3 weeks. And the first injury I got to see was a fractured wrist. And I just remember this girl coming up to me going, I need you to tape my wrist. And I looked at it. It was bending from here. So I was like, I can't tape that. It's a broken wrist. You need to go to the hospital, get that x-ray to get it set. And she started yelling and screaming at me. She's like, it's a gold medal match. I'm going to go. No, I'm going to keep going. I'm going to win on points. She's yelling and screaming to cut this short. The parents come over. They start yelling and screaming. They walk away. The coach comes over, yells and screams, walks away. Eventually, they go and find Len, who's the director, the medical director, and Master Choi, who happened to be the director of the entire event. And all of them are now yelling at those two people. I could see this off in the background like, oh my God, I'm dead. I'm dead. I'm dead. I'm dead. And Len eventually comes walking over to me probably about 5 minutes later after getting ripped apart by these people. And he looks at me again. I don't know him now. This is now one of my mentors, but I didn't know him then. And he literally looks at me and he goes, did you refuse to tape her wrist? I said, Len, it's broken. She's got to go to the hospital. I can't tape that. What happens if she gets hurt worse? And he just looks at me and he goes, good job. And walked away. And that was really my intro. From there on in, between Len, Bill Bonsall, Ira Shapiro, and Mark Jaffe, I followed them everywhere for 5 years. Every sporting event, every seminar, everything under the sun they could do. I followed them, and I got more education in that 5 years than I probably could have done in 30 years on my own. So we always stand on the shoulders of giants that came before us. That I think you would agree with me on that. And then teaching, look, Dick Vincent, and I know you knew Dick very well. Dick Vincent is the person who got me into teaching, and I was only 28 years old at that time. And I think he had seen something in me that I didn't see in myself at that point. And he invited me to go to a grass and technique seminar. I refused. He called me up again. He says, I think you should go to this seminar. And I said, no, I'm good. I do a lot of active release technique. That's what I'm happy with. He called me up a third time and he said, if you don't go, I'm not talking to you anymore. So I got my butt to Massachusetts. I took the first seminar, which eventually turned into an instructors group. And immediately I started doing movement stuff with the instruments that everybody was doing statically because that's what they were being taught. And I was right away going into motion-oriented things with the instruments. And I guess it struck a chord. And the next thing you know, as we go through 3 more of those seminars, now all of a sudden I'm teaching for grass and technique. Within a year, I'm writing seminars for grass and technique. Within 2 years, Tom and I had already started writing FAKTR, which was then called the Module 3. And in all honesty, Module 3, the first Module 3 we ever taught was in March of 2004 in Newark. And as you know very well, and I know you very well, you can't sit still. You get bored. Our brains don't work that way. You got to keep moving, got to keep moving. So eventually FAKTR started blossoming into putting everything under provocation. We started discovering that if you put an injury or a restriction or an imbalance under its provocation and treat it during those, you were able to, and again, at that point, we didn't really know what we were doing, but you were able to reset everything much quicker. It was almost like overloading the nervous system, hitting Control-Alt-Delete, rebooting it, and all of a sudden people were coming out well. And we didn't know what we were doing. We just were doing it. It was an instinctive thing. We started doing it. I was still practicing. Tom had retired at that point due to a disability. So I took it back to my practice and I just started doing it on everybody. And I started seeing it happen on everybody. And I was like, wow, we've got something here. I just don't know what it is. And then, a couple of PhDs come along and they start explaining what it is that you're doing. And now that's largely how it's been taught. And Tom and I largely separated from I shouldn't say the ownership of FAKTR, but literally the direction of FAKTR started splitting into different directions. And that's when I created functional soft tissue in 2012, which then became, rather than a technique oriented class, which we never really called it a technique class, it was more conceptual. But then it went to a diagnostic class. In other words, I started teaching it as in, hey, if somebody comes in with shoulder impingement, what are the causes of shoulder impingement? Why are you doing this soft tissue procedure on this person based on this examination? Why are you doing these rehab procedures based on this evaluation? Why are you doing this taping based on this evaluation? So it became much more diagnostically oriented. And I really struggle, Craig, and I venture this is a challenge for you too. When you teach technique, it's very hard to teach technique and not be a clinician. So I decided to stop teaching technique and just start teaching as a clinician. So everything I did is if this, then that. If this is what shows up, this is why you're doing it. And whether it's my taping classes, whether it's soft tissue, whether it's my rehab classes, everything is the same way. If this, then that. So it's all conceptual. It's all diagnostic. It's all based on real clinical practice. In fact, one of my taglines that I didn't even come up with, it was actually one of my student liaisons at Cleveland, Kansas City said, he says, when you take Greg's class, you don't learn to be a technician, you learn to be a clinician. And that just became kind of a tagline. Don't learn to be a technician, learn to be a clinician. That's what my classes are. So, and holy cow, but now that's 26 years later. I'm shocked that it's been that long, and teaching is going to be a joy of mine, hopefully for the rest of my life.
Absolutely. So
now,
we met.
Yes, go ahead. Go ahead. I was going to ask you a question. Go continue on with yours.
Oh, okay. I remember very well when we met, and you already mentioned the late, great Dr. Dick Vincent,
yep,
who was a mentor to both of us. And also, well, I think of mentors, it's kind of a broad stroke when I talk about the term of mentors. There are those who I consider to be mentors because of what they've written or what they've stated, because of the impact that it had on me. That I can say because they said that, they did that, then it changed my perspective in a significant way. And in that, they mentored me. But then there's also those that really took the time and went out of their way and as I would say, very patiently put up with me and my questions and my quirks. And despite all of that, still felt I was worth putting time into. And that was certainly Dick Vincent. And so I was inspired when I first met him because it turned out that it was his name on the bottom of my diploma from the National Board of Chiropractic Examiners.
Yeah.
And after that, I got involved in hockey. I worked for the National Hockey League thanks to his brother. He introduced me to his brother, Paul Vincent, who was a hockey coach, who ended up becoming the skills coach for the Tampa Bay Lightning. So he was huge impact, had a huge impact on both of our lives. And it was thanks to Dick, actually, that he contacted me one day. I was going to be going back up to Buffalo for a course with my Professor Vladimir Yanda from Prague School.
Mm-hmm.
And we were talking about it, and he says, I have a friend, a colleague in New Jersey who would like to have you come and teach a rehabilitation course, weekend course at his clinic. He's got a large multidisciplinary clinic. And we think that your concept and your information would be really important. So if you would mind going up and teaching a small private course before you head up to Buffalo. And I said, essentially anything that Dick recommended that I do, I learned very, very well that he would be crazy to avoid. So that's when I went, and I think that's when we had the chance to meet that weekend when you were a young buck, just new in practice, working for Dr. Peter Flom.
Yes, it was a very, very interesting time in my life because I was being introduced. Craig, please don't take this the wrong way. I was being introduced to people that I honestly had no business being around. They were just so far above my level clinically, thought process wise. It was just so much more advanced than where I was at this point. And I was being introduced to a lot of these people at that time. And I'm going to remember one specific thing because, again, you and I could probably go on for hours talking about things.
Right.
But I remember this one thing in particular with you. And you may remember we were talking about hamstring length. And in our office, and at that time, understand that most of my clinical education came from the PTs. The chiros that I was working with at that time were literally not going to be giving me, not that they were bad chiropractors, I don't want to make it sound like that either, but they weren't going to advance my clinical skills significantly considering I was already starting to do some sporting events. So I was learning almost everything from the PT, stuff that I didn't learn in school, the way they were doing things, everything from muscle energy techniques to, supine to sit testing, things that I just wasn't exposed to. And I remember in particular, we were always talking about like Eric, who was the PT at that time, a dear friend and a very brilliant mind. He was always saying like, tight hamstrings, tight hamstrings, tight hamstrings. And there you were, you walk in and go, no, it's not. It's not tight hamstrings. And I was like, well, okay, how do you know it's not a tight hamstring? And it was such a brilliant and simple, it was so simple, but the brilliance of it. And again, something that I just wasn't exposed to or had any knowledge based on, but it went right back to the neurology of things. It's not a tight hamstring. It's the sensation of a tight hamstring. And going through the process of, can I get that leg anywhere near 70, 80, 90 degrees of hip flexion? Well, okay, yes, you can. That's not a tight hamstring. What it is the pelvis is rolled forward, the core is shutting off, and the neurology of that is you have the sensation of the elongated hamstring, therefore it feels tight. And all of a sudden, it hit me like a cinder block that I was treating patients wrong the whole time. Now, the crazy thing is we were getting them better, but we were still not doing it to the optimum of what we could. Because in all honesty, I'll be the first person to say, I didn't understand what was going on. You were that first person coming into my life that literally took me off the path that I normally would have walked because this is how I was educated, and started getting me to think in a pathway that I had not understood. So in essence, you probably started me on the neurologic aspect that everything that we do isn't physical. It's not orthopedic completely. And that a lot of what we're doing is really more based in the neurology. And the more and more I get into practice, the more and more I realize most of it is based in neurology, not in ortho or physicality. And that a lot of what we need to do is retrain neural pathways, motor pathways, things along those lines that has a neurologic basis to it. It's not so much as Grasson technique, always telling us we were breaking down scar tissue and adhesions. No, we're not. Most of it is we're just resetting the neurology of the tissue. We're not doing that physical change. There's very few times that we do that physical change. So you were probably that first person that was my light bulb that said, stop thinking physical. Like a knee's a knee, an ankle's an ankle, a toe's a toe. No, it's not. There's other things going on. And you were probably that first person to give me that light bulb.
Very interesting. Well, I'm glad I had that kind of an impact because where you started from there and the seed that I planted, look at the, I could say that grew into a plant, or I could say it grew into a tree, but I'd say it probably grew into a forest.
Well,
By analogy, because of the impact that you've had through the profession, and I think not only through the chiropractic profession. I believe you've also trained many physical therapists.
Yes.
I believe, over the years.
Athletic trainers.
And athletic trainers. Yeah, this has been we've been very fortunate, and personal trainers.
Yeah, and South America medical.
Yes. Well,
a lot of the times in South America, it's the medical doctors doing a lot of these hands-on approaches.
Right, exactly right. I've had the same experience. Although medical doctors here, because I was involved with the American Back Society for many years, which would have been your earlier years, but as a result, because American Back Society was, a blend, of largely, I think, physicians, but there were a lot of chiropractors and physical therapists, and we could all be members of ABS back in those days, whereas like NAS then is still around, National
Yes.
North American Spine Society, but you can't be a full member as a chiropractor, as a physical therapist, so as a result, I wasn't interested in that kind of dichotomy and double standard, whereas American Back Society. So I was happy to be involved with that and an instructor along with great Donald Murphy out of Rhode Island,
Oh yeah.
my longtime buddy, and we studied together in Prague. And so yeah, so this was a critical integration, and certainly I was inspired also through the Prague School, through Professors Levitt and Yanda, the founders of the Prague School, the first generation, because Prague School was founded all by neurologists, and they were very different than a typical neurologist, and whether it's in Europe or here, there's one thing I love about medicine, and there's many things, is how that they're mature enough to really have fun to tease each other. And the neurologists and the orthopedists love to poke fun at each other, and even at themselves. An old joke that I heard years ago was, what's the difference between an orthopedist and a neurologist? And the answer was, the neurologists know everything and don't do anything,
Yeah.
and the orthopedists do everything and don't know anything. And what Prague School ended up, they say, well, we're neurologists, but we're going to kind of kick away and we want to do stuff too. And in the end, they kind of brought a lot of us along also with that. I think this was a big part of the Prague School's pact for us to start thinking neurologically. And so we see how this spread all through physical therapy and chiropractic and athletic training now. So it's a different day, and it's an exciting time to see how, especially when you get, I'm 42, almost 43 years in practice, and you start to look back a little bit more, especially when you're semi-retired like me, and you have a chance to say, well, what have I done, and what have I observed, and what have I watched? And we see the significant changes. But the younger guys, and you can be almost 30 years in practice, but it's all relative. Like your children
Yeah.
they'll always be kids. They can be in their 60s, and they're still kids. So your younger guys, to me, with your energy and your ability to communicate better, I think with the younger audiences and students, to see how it's spread practically and organically is really, really exciting. And I have to take my hat off to you, because this is a lot of work and a lot of heart that you put into your years of teaching, training, and practical application.
It is interesting, because I always, in my earlier part of my teaching career, my favorite people to teach were actually the docs. And I can't even tell you why. I don't know if it was ego, if it was the true joy of just spreading the knowledge or making clinicians better. The ego aspect of it that I mentioned is it was always wonderful having people come up to you after a class and go, I was actually thinking about retiring, but now I'm going to continue. That's a pretty powerful statement for a young guy teaching in his infancy and having somebody hit you that hard. So it really made you feel good.
Yes.
But I have to admit, as I moved on in practice, I have to say probably about halfway through my practice, or my teaching career, I should say, I started switching over to the students. And I started to really just relish their enthusiasm, their never ending energy, their sponge like ability to keep hearing and hearing and hearing. And something that I've always done in my classes when I teach at schools is I encourage retakes. So I know you and I do the same thing. We keep our prices pretty darn low for students so that they can attend the class.
Yes.
I've always done retakes for students a third of the price of the regular class.
I think that's great.
So that they can come back and literally, you're full on participant. you getting everything that was there to begin with. But I've always loved the fact that I've seen the same students come to my classes 2, 3, 4 times before they graduate. And every single class, they say the same thing. They come up to me and go like, I can't believe how much more I got of it this time. Oh, I can't believe how much more this time. And again and again. And they'll actually make comments to the younger students going like, just keep coming back. You have no idea what it's going to eventually turn into. I recently just had one doc make a comment to me on a text message saying, I was happened just to reconnecting with a lot of my student liaisons from this one school. I'd been teaching there for 13 straight years. And he sent me a text message back and said, I just want you to know I was dropping out of school until I took your class. And he said, now I knew what I could be as a chiropractor because I didn't feel like I was getting it in classes in his curriculum. But now all of a sudden he's like, this is what I thought I was going to be getting in school, and I got it in your class. And now he continued on. He's exceptionally successful, several years in practice at this point. But I think being able to disseminate the knowledge that others have given me, that I've been blessed enough to be around. The one thing that I will give myself as a somewhat of a gift is I'm creative. If I hear one great thing, I'm going to probably turn it into 10 or 15 great things. And it's largely because I love to listen to people smarter than I am. And their ability to educate me and constantly keep my brain moving. As I like to say, pull off the dead hamster, put the new one in, let it start spinning on the wheel again. It's really been a joy to start moving into more of the students. In fact, the last time I lectured at the ACA Sports Council Symposium, I got a call up and they said, hey, docs are students. And I said, what do you mean? They're like, well, you're lecturing. I said, I didn't put my name in. He said, no, you're lecturing. Who do you want? The docs or the students? And I went, you know what that answer is. It's going to be the students. I love the students. I like seeing them become better than what we are. And I had an associate once say this line to me, and he stopped him. It's actually how he got his job. He was working on something. I was training him to do something. So he's working on my ankle. And he said, I love what you have. He's like, you've got these connections with all these amazing people. And he's like, I don't know if I can get that if I go back to Pennsylvania. I said, of course you can. No matter where you go, you can develop relationships. That's not it. It's about putting yourself out there and devoting yourself. And you'll find all these people. He goes, yeah, but you have this amazing network and all this great information. He's like, and someday I want to be as good. And he stopped himself. And before he could say as good as you, he says, no, I want to be better than you.
There you go.
And I said, that's good, because if I'm going to teach you everything I know and you're going to keep it exactly the same, I wasted my time.
And then, it's a perfect lead into what it is, ACE's Optimus is about, because I'm in the end not interested in my students being as good as me. I'm not interested actually in them being better than me. Because in the end, the only person you can really compete with is yourself.
Yeah, that's true.
And so I'm really interested in them optimizing their potential and not being satisfied. Einstein said, curiosity is more important than knowledge. And I think that you were talking about your creativity and all this, but essentially, I just think we're alike. And I found this along a number of my other, what I would say, my other proteges around the world, and that is that they were the ones who had this really curious mind, and as a result, and they were a bit, I guess we would say, also a little bit stubborn. In other words, there were questions that arose, and they just were not going to be satisfied until they were able to satisfy those questions that arose that were inspired by some scenario, by some mentor. And in the foreword of my textbook, which I think we're going to talk about our authoring experiences, is I in the foreword I gave tribute to Professor Yanda, and also to the body of my patients who were my main mentor. And I think it sounds.
I think that's wonderful, by the way, with the patients.
Yeah,
they do teach us so much.
Yes, because you know, it's like when you have a parent and you're parented or you're disciplined, you don't appreciate the discipline at the time. And the patients, you know, they're really very inconvenient because they haven't read those textbooks and they haven't put time in those in the seats in the class. And so they can be extremely uncooperative in their reactions and their responses because they're not following along the guides. And but as a result, they take us out of our comfort zones, and that's in the end, I think most humans, that's the only way we grow, isn't it? To be
Yeah.
taken out of that comfort zone and say, "Damn, you know what? They should have, you know, the 6 visits should have resolved it, and they're not." And uh, I wanted to also just make a quick note also on your earlier statement regarding keeping your courses practical and clinical, and that you had have these findings, and then you find that leads you to you know, why would you react or why would you treat it
Yep.
therapeutically because of those findings. And I'm not sure if you've ever read the book, but I was inspired by a doctor by the name of Fred Barge.
Oh yeah.
And you know, I took a course with him, a scoliosis course years ago. And he also, in addition to a scoliosis book, he wrote a book called Are You the Doctor, Doctor? And in this book, you know, it was about uh, taking responsibility for your patients and not, you know, because it can be very easy to say, well, you know, the musculoskeletal area is just my thing, and anything out of that, you know, it's not my issue, it's not my problem. But in the end, you know, he was many would consider him very conservative clinician, but at the same time, in his book, he talked about um, the you know, the breadth of his approach to clinic and the responsibility that he took. And I thought it was a great inspirational book that had an impact on me. And again, I consider him a mentor, even though I took a 1 weekend course with him, although I ended up calling him a few times with questions over the years. And because I think that's our nature, right? If there's something and you need the answer to it and it's too important,
Yeah.
and you can't find the answer elsewhere, then you go dig it out someplace. And I think we're kindred spirits along those lines.
It's I got to say that that aspect of constantly searching for the answer, that's sometimes it's not always there, by the way. I mean, it's not like
Right?
you're always going to find the answer, but I have had some kind of sleep disorder my whole entire teenage life, going all the way through now, and I've noticed with patients it's worse. The more complicated the case is, the more times I'm waking up in the middle of the night with the wait, no, that's not going to work, and I go back to sleep. But I notice that I get some of my best ideas completely when I'm unconscious. So thank you, subconscious, for constantly working even when I'm not. And I've come up with more tape jobs, more rehab exercises, more soft tissue treatments than anything I could ever come up with in the waking hours. It seems to always happen when I'm sleeping, which used to be a pad. Then it became a digital recorder. So now I just wake up in the middle of the night. I'm like, blah, 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 put the darn thing down again. And at least in the morning, I won't forget it.
Interesting. Yeah, I've had those wake ups. That is all part of it, and making notes and writing it down. And we're going to talk, and we want to talk a little bit about our experience as authors when we
Oh,
talk
God.
about writing. So I did not know until just we were speaking beforehand, before today, that you were involved and you contributed a chapter in Dr. Tom Hyde's sports injury textbook, the
Yeah,
second edition,
the second edition.
right?
So yeah, I
Tell me
was
about that.
I had the pleasure of assist. I was supposed to be an assist. My entire job was there because, again, we're talking, that was mid 2000s, I think, when we started that process. So you're talking about somebody who is roughly 7 years out of school. I'm not supposed to be authoring anything, but I was happy that they gave me an opportunity to be part of it. So my job was literally to do the research. I was doing all of the footnoting, all the research, all of the lines that were going to go in, the quotations and things like that. And I spent, I don't know how many thousands of dollars, first of all, on articles. The textbook ended up with 212, or that chapter had 212 references. So needless to say, that was a hefty undertaking from my standpoint. And I had some experience in technical writing from actually starting in high school. I had a professor who really taught me how to do this very well with note cards, and then lining them all up as how you wanted them to fit. And then eventually it starts writing the paragraph by itself. Well, let's just say I started doing that. I had all my note cards. I started typing this all up into bullet points, and then I sent it on to what was supposed to be the lead author. No names. I'm not using it right now. Needless to say, Tom, and you've known Tom very long as well, I would get calls from Tom, him yelling at me, going, "Where is the shoulder chapter? Why don't you have this done yet?" I was like, "Tom, I would have killed if you gave me the shoulder chapter. I love shoulders. That's one of my things. I'm doing the elbow, wrist, and hand." And he goes, "What are you talking about? You're doing the shoulder." I was like, "Tom, I love the shoulder. You didn't give me the shoulder. It was the elbow, wrist, and hand. I've already sent all the material on." A week later, I'd get another call from Tom. "Why isn't the shoulder chapter done yet?" So needless to say, I got yelled at by Tom almost on a weekly basis for not having the shoulder chapter done, which I did not do. And eventually at some point, the elbow, wrist, and hand chapter found its way over to Tom. Then I got a call up saying, "What is this garbage? It reads like bullet points." I said, "What?" So all of a sudden, he sends me the rough draft that was sent by the other author, and all it was my bullet points. It was never put into chapter fashion. And then all of a sudden, he's like, "Well, you have to do it." So basically, I took all of the clinical aspect of the elbow, wrist, and hand chapter, ended up having to put that into paragraph form. He brought in 2 other authors, because at that point, I didn't have time to go and bring back like the anatomy, basically biomechanics, angles, things like that. They wrote that beginning section, and then I wrote the clinical section of it. It was a harrowing experience. It took me, I don't know, probably better part of a year to write. I think it took about 2 years to publish. And then I read it, and the first thing I thought of was I would rewrite it all over again, because this is not what I would do anymore. I'd already evolved. And I called up Tom and I said, "Thanks for making my life so miserable that now everything I put my heart and sweat into, I feel is now obsolete." And he just said, "Everybody who's reading that is already 10 years behind, and they're reading it and getting caught up. Stop thinking about where you are, thinking about where you're bringing everybody else to." That was also pretty powerful.
Professor Levitt, founder of the Prague School, his book, I think, ended up having 6 or 7 editions. And one day in lecture, he said, "Any of you that are writers," he said, "if you don't take a look at something that you've written that's more than a year or 2 old and say to yourself, 'Who was that idiot?' then you are not an honest author."
That's yeah, very, very true. I have to say, I've read that chapter that I wrote once, and I've never picked it up again. And it's for that reason. I look at it going, holy cow, I can't believe I wrote this. It would be so different today than it was. And again, if I had rewritten it 2 years later, again, I'd be going, nope, it's old again. It's just amazing how fast we evolve and change in what it is we do clinically. There's always things that say, I always describe our ability to take care of people. I use this analogy a lot in classes. I'm going to give you the trunk of a tree. I'm going to give you some branches. It's your job to put the leaves on the tree. And the leaves are the creativity. Like the trunk of what we have is going to be there. The branches, some might fall off, some new ones may grow, but the leaves come and go every year. And that's the creativity. That's where we actually get to evolve every single, well, I mean, I'm using the analogy of a tree every year, but that's where we get to evolve, and it changes every time. Again, talking about people who have taken my classes 3 or 4 times, they've literally told me the class was never the same twice. The material is the same, but the class is never taught the same twice.
I think it's a brilliant analogy. I love the tree and the branch and the leaves analogy. I think it's brilliant because it really gives a structure that the students can understand, but it gives them the freedom to try to specialize, to not, because we all tend to, if we start to learn new concepts, we're looking for something that's very structured. I use the analogy of a chef versus a cook.
Mm-hmm.
So the cook goes and has them. They have the recipe, and they cook a cup of this and a tablespoon of this and that and all of that. But then with time and repetition and some curiosity and some confidence, then you start to get it, and you go, a little bit of this, and pretty soon you didn't even bother. Well, you know what? I don't feel, I don't feel like washing that cup. This looks about right,
Yeah.
and about this much, and about that much, and in the end, I like the analogy about, in the end, you're dosing, and how much force do you use with a thrust manipulation, or if you're doing a release technique, how much, and in the answer, nobody likes it. They like really hard, fast answers. They like a cup. They like specifics.
Yep.
But I always use the analogy. It's like a hug. If it's too short, it's impersonal, and if it's too long, it's uncomfortable. So in the end, the right amount of time for a hug is the right amount of time.
Yeah,
it's relative to the time and the person and the circumstances.
That's a fascinating way of putting that as well. I have a summer intern right now. Now, this is a high school student, but the high school constantly calls me up and says, we have another kid who's interested in going to healthcare. Do you mind having them come in as a summer intern? I've never turned one down yet. And he says to me, I love him because he's very inquisitive. He's always asking questions. And sometimes, of course, in the middle of a treatment, you're like, I don't have time for this. But nonetheless, I love the inquisitive nature. And he's always asking that. How much force do you do here? How do you know to push that hard? How do you know this? And I said, Ethan, the reality is what we learn in school is a base of knowledge, but there's a massive art to being able to imply that knowledge onto a patient.
That's the art. Yep.
And it's the art that says I can be as light as a feather or as hard as a brick. And it depends on the person who's in front of me and what I'm trying to accomplish.
Yep.
And I know, as you were just saying, that's a tough answer for a lot of people, because It's not a cut and dry. Right. It's shades of gray, from the lightest gray possible, close to white, to charcoal.
Yes.
And it's everything in between. So giving definitive answers is almost impossible.
No, it's impossible. A good colleague of mine, we studied together, Prague together, Dr. Jerry Hyman, who is a brilliant clinician, and actually a former trombonist for Blood, Sweat, and Tears, the old rock and roll band, before he developed Bell's palsy severely and then became a chiropractor. But he used to say, don't do what I do, feel what I feel. And I always thought that was a great way of starting to write, to kind of work into that relativity, that it's a gray zone. And sorry if I can't give you hard answers there, but let's feel along together. And I thought that was a great way of stating it, that helped me understand it better.
Absolutely. And that's also another reason why two clinicians who can do the same exact procedure won't feel exactly the same way to each patient.
Oh, that's right.
Because two hands can never be exactly the same. In fact, my hands can't be the same from Monday to Tuesday.
That's right. But with teaching technique, it does help us to be able to assess, and that was something I felt I was forced to do with some palpatory techniques.
Mm-hmm.
I talk about, both for clinical literacy, I talk about both palpatory and visual clinical literacy skills. in my book and lecture, and um, uh, that it's worthwhile assessing the capacity of your students, because you need to take them within their capacity for the time at the time. In other words, if I'm going to uh, ask something of them that they don't really either have not everybody has the same palpatory skill, right?
Yes.
And so you have to say, well, I can teach them this, but I can't really go there in this case, because all I'm going to do is frustrate them. And so it's a relative issue, this teaching of your group and your students, right? And we have different, there's areas that I've gone to courses or had instructors that I didn't get it. And so students are the same at times.
Now, Craig, can I pose a question to you now?
Sure.
You and I have had these conversations multiple times actually in the last couple of years regarding what we've seen post-COVID. Almost the lack of enthusiasm to elevate knowledge, the lack of interest in getting your hands actually in a hands-on class.
Yes.
You just kind of said it. How do you see the ability to get our students, whether they're clinicians already or whether they're in school, how do you actually pose a statement to them at this point that says, if you want to be good, if you want to be great, if you want to give the best service you possibly can to the patients in front of you, how do you look at getting people back into enthusiasm of hands-on? You cannot learn the art by watching a video. How do you see a way of engaging those students again to actually bring them back into a hands-on environment?
Well, I think that there's a couple. One, by having them observe treatment of a patient, and to understand, especially on those cases where it's good to have a miracle every now and then, can come in really handy, and to open their eyes along those lines, because what we need is new types of inspiration. And COVID took away a lot of curiosity, and it also, as a culture, pushed us into kind of following along without. And I have physicians, all of those medical doctors, physicians had to follow more in line, and they do follow more in line within their areas of specialty, for example, now than they did before. They felt more clinical freedom pre-COVID than they do post-COVID. And those that haven't followed along in lockstep very often have had professional complications as a result, because they went out of their lane, so to speak. Mm-hmm. And so I think that we are in a transition to be able to get curiosity back, and I think we need more communication and teamwork among different factions and groups and instructors within our groups to inspire the students so that they can hear it. Because a lot of times, for example, like as if you have your wife or your partner, for example, might tell you something like, that type of shirt, that's not the best one for you, or that's not your best color. Okay, well, all right, I'll keep that in mind. But then if you go out and you hear a second person say, oh, what, that's not your best color, then it hits home just by him. And a lot of times they think it's because we don't listen to her. But a lot of times it's only that we have some confirmation, and confirmation is helpful. Yes. So if we have instructors that are teaming more together and saying more of the same thing and promoting each other, which is something that I plan to do for advanced clinical educational seminars, for example, I would like very much to have a link on my website to your courses, so that, because I'm going to put a series of instructors that I think are very important for my students to listen to and consider taking courses from and listening from. And it's the key is that we have a number of the same foundational principles, and I, just as we've discussed here, but at the same time, we have a different background, a different history of patients, a different way of looking at the things. And so this gives the opportunity to have a certain way of thinking, but a whole new knowledge base and a way of explaining the things that can connect and grow the patient to become a chef, a clinical chef, if I'll use that same analogy.
I love that too. And that's, everybody always talks about the more tools in your belt. I have something, and I'm going back to that physical therapist that I first started working with when I was a student. And he asked me one day, probably when I was in my second year of chiropractic school, and said, "What's the greatest tool you have to treat a patient?" And of course, being the good chiropractic student that I was, I said, "An adjustment." And he goes, "How do you feel about your brain?" Another light bulb experience. The brain dictates what we're going to do and how we're going to do it.
Yes.
You just want to have as many abilities to use, pick things out of a hat. We all have our primary ways of going after something, but you want to have as many different facets as you can to treat as many different people as you can. Because if there's one thing that I know for sure, and one thing I can't stand in seminars, is when they say, "Oh, this works for everything."
Yes.
It's just like a multiple choice test. If it says all or never, it's wrong.
Yeah. Greg, I think our time is running out. And so two things, multiple things. First, I want to thank you for I know you had a long day of treating patients, and so you've taken time out of your evening, and so has Derek, to accommodate this podcast. But I think that it's your background and your sharing of your knowledge and your experience has been absolutely brilliant. And as a result, I think, like discussions we've had before, they always seem to be too short and time passes by. I can only hope that our listeners will feel the same as we did, and what I would like to do is have the opportunity to bring you back down the road so that we can continue on, because I think we've kind of scratched the surface. But I would like to, again, you can please, your email, your website.
My website is functionalsofttissue.com.
And so you can find Dr. Greg Doerr's courses, background, and everything.
And my videos.
Work. And what?
And my videos.
And videos, yeah. All on that website. Certainly, we like to have you join us at the ACES for Me. That's Advanced Clinical Educational Seminars, ACES4me.com. And we have upcoming pediatric 1 course, DNS pediatric course. We're bringing in Yuri Halamka from Prague, September 5th through the 7th, a 3-day course. If you're interested in that, you'll see we have, it's normally a 4-day course, and it will be 3 days, compressed a little bit, but it'll be wonderful. So we hope you consider that, and also an A course, DNS A course coming in October. There's also a couple of DNS courses, A and B, up in Buffalo in September and October through MSK.com through Dr. Glenn Harris. And with that, I'd like to thank you for joining us. Thank you so much, Dr. Greg Doerr.
My pleasure. Anytime.
And we'll see you next time on ACES Optimus.
Thank you.
Thanks for tuning in to this episode of the ACES Optimus Show. Catch you on the next one.